Hello everyone, I'm Linda Lee, and today I will be talking about medical receptionist training tips, such as the roles, duties, skills, and traits needed for medical receptionists in a nursing home, physician's office, or other healthcare facilities. Who are medical receptionists? Medical receptionist works in the front office of physicians, clinics, and nursing homes or other healthcare facilities. However, they are differed from non-medical receptionists in the way that they deal with patients as opposed to customers. They are trained through formal training and methods used to develop the necessary skills to address the busy atmosphere in which they work. What do medical receptionists do? Medical receptionists answer the phone. They schedule appointments for patients, greet patients when they come to the office, check patients in by screening insurance eligibility, and check them out to schedule any follow-up appointments needed, collect payments from patients such as co-pays or other payments needed for the office visit, maintain records and accounts, file records, and creating accounts for patients. They handle written and electronic communications. They submit prior authorizations and direct referrals. What are some effective training methods that a medical receptionist may need in order to develop the necessary skills to address the busy atmosphere in which they work? This includes formal training, appoint a trainer, establish the receptionist role, and hold regular meetings. How are formal training usually done? Formal training is usually done at the job site or prior to employment. They need a 2-year associate degree or a 1-year certificate program that is done at a community college or technical school. They need knowledge of medical terminology, insurance coding, and office procedures. Medical receptionists are usually appointed by a trainer, and that trainer is usually the office manager. The office manager introduces the medical receptionist to the facility, other staffs, physicians, and nurses. They are given a training manual that explains the office's policies, procedures, and expectations. The medical receptionist roles are usually established and appointed by an office manager. Medical receptionists must obey office policies and procedures as well as following HIPAA regulations by protecting patients' confidentiality. Regular meetings are usually held for medical receptionists weekly or monthly to strengthen new information, providing visual presentations and reports, identifying problems, and finding solutions to improve the organization for patients, physicians, and other staff. What are medical receptionist job duties? Medical receptionist job duties includes ensuring availability of treatment for the patients by filing and retrieving patients' medical records, maintaining patient accounts by obtaining, recording, and updating personal and financial information, help patients in distress by responding to emergencies, maintaining operations by following policies and procedures and make necessary changes as needed, maintaining patients' confidentiality of personal and financial information to obey HIPAA regulations. What are medical receptionist job duties? Medical receptionist job duties includes keeping the business office inventory and equipment in check, such as anticipating the needed supplies, placing and expediting orders for the supplies, and verifying receipt upon delivery. Scheduling equipment and service repairs are as needed. Other medical receptionist job duties include maintaining the reception area and improve patients' satisfaction. What are the skills or traits needed for medical receptionists? Medical receptionists need to be friendly to the staffs, physicians, and patients. They need to have good communication skills such as verbal and written skills. They need to provide good customer and patient service. They need to be organized, keeping the area clean at all times. They need to have patience in everything they do. They must be able to multitask, dealing with two things at one time. They should be able to make decisions and the appropriate decisions when needed.